Today we're going to talk about how I wind down for sleep. And this is something you can do for yourself. Sleep seems to be one of the things that so many people that we see are dealing with, and it affects everything. I am Dr. Natalie Gonzalez. I'm from Synergy Health and Wellness. I originally was a surgeon, so I'm a retired surgeon. I now do integrative and functional medicine. Integrative just means I use the best of both conventional medicine and alternative types of things to help people with their health. And functional means that I look for the root causes of whatever they're struggling with, the root cause of their health condition. Sleep, it affects everything. It affects your immune system, inflammation, brain health, for cognitive function, hormone regulation, and stress regulation. In everybody that we see, sleep becomes a major focus. And sleep, in order to wind down, you have to be intentional about it. And it needs to begin about 2 hours before you actually want to be asleep. If I want to be asleep at 10, then I usually start about 8 o'clock. I make sure there's no bright lights in my eyes. Something that I'm doing right now where I have bright lights, I would not be doing that in the last 2 hours of my day. I like to either lower the lights in the house. Sometimes that means if I want to read something, it's going to be a little more dim light, a little more yellow light, and it's going to be directly on the page of what I'm reading, not directly into my eyes. When I have my computer in the evening, I need it on the black screen with the white print. I need it to be as low level light for the brightness of the screen as possible, and maybe wear blue light glasses, blue light blocking glasses. The second thing is I try to make sure that I'm not getting major active stimulus in the evening. So not to read a really exciting book or a mystery, not to be watching a TV program that I'm getting really wound up for. So I have to avoid those at that time of night if I can. This is intentional. You have to decide to do these things, because they don't happen on their own. Not to be doing your taxes or finances at that time of the evening, not to be involved in a debate with somebody at that time of the evening. Anything that really winds you up emotionally, I really have to avoid those things. So I do something boring right before bed, listen to something that's low key, like a meditation. You know, my husband and I are working on learning a new language, and that can actually be low level enough to put me to sleep. And that's the other thing that you want to do is once you are falling asleep, once you start to feel like your eyes are closing, your head wants to just rest down on the pillow, it's really the time to pay attention to that cue and lay down and just let that overtake your body. It's a really nice feeling if you let it happen. If you are having trouble feeling that, then I generally have people try melatonin. Melatonin is not to help you stay asleep, it's to help you fall asleep. And you make your own melatonin every evening when you just lower the lights in your environment. That low level of light signals your brain to start making the sleeping hormone melatonin so that you can use it to fall asleep on your own. If you don't make that, then melatonin is something you can take. I would use the fast dissolving if it were me, because the fast dissolving under your tongue works way faster than the one that you take as a pill. Usually most people can do pretty well with 5 milligrams or less of melatonin. Your body makes a fraction of that. Your body makes, it's really small amounts, like 0.1 milligram or 0.2 milligrams, just from lowering the level of light that's directly in your eyes. Your brain, that is a signal to make the melatonin. If you're shutting the lights down, you're just doing some listening, just doing some low level light things that are non-stimulating, you will find that your brain is making its own melatonin. It's really going to be a matter of you paying attention to that cue that your body gives you, either the yawn or your eyes starting to droop, or you just take a deep breath and you notice, wow, that feels good to just relax a little, just feel like your head's nodding and you're just wanting to lay down somewhere and relax. That's your cue. Those are your cues that your body's giving you. And with this intentional practice of winding down for sleep, I really want you to learn how to pay attention to that and how your body is feeling and what it's telling you. And pay attention to it enough to actually take advantage of it and do that. This is what we do with all of our clients who are dealing with any kind of health concern, because sleep affects everything. Take these things and pick one and just do that. Just do one thing at a time. In the meantime, if any of this information has helped you and you think it might be able to help a friend or someone you know, make sure you share it with them. If you haven't already, like and subscribe, and we will see you in the next video. Take care.